the Coordinate Coffee Hour sessions. This is the 5th session. We have them every week, and I'll just quickly take you through the ground rules and a quick intro. We're going to be recording this session for our own documentation and future work, so we're hoping that it's all right with you, and in case if it's not, please let us know in the chat messages, and we'll keep that in mind. To save bandwidth, it'd be great if you could turn off your camera until you're speaking, so that would be great. Among all of us, we also speak English and Hindi reasonably comfortably, so please feel free. अगर आपको हिंदी में भी बात करनी है, कुछ सवाल पूछने हैं, तो हम सब reasonable level की हिंदी बोल सकते हैं, तो please उसका इस्तेमाल करें. We have ample time dedicated for questions, so we'll have some time, and that's why we've also requested the speakers to be brief, so hopefully that comes through. And in the meanwhile, we will be liberally using the chat section. So अगर आपके कोई भी सवाल, comments हैं, if you want to connect with anybody, please just reach out to people using the chat window, and they will get in touch. We're all keeping track of that. Great. Very quickly, some agenda setting for today. We've all gathered because we're curious around about the connection between gender and how especially COVID-19 looks very different from a gendered lens. I'll quickly be doing some agenda setting, followed by which Sonalde will be sharing some insights from a study that NCAER conducted recently. And then what we're going to do is get into quick reflections from SEWA, from ISST, and from IWWAGE, who all work around the issue of gender livelihood. And they've been looking at how, especially for women, the pandemic and the lockdown has severely sort of affected their work, both in formal and informal terms, and we'll discuss that. And following that, we've kept about 20 minutes to not just discuss questions and thoughts that the group has, but also think through what might be emergent gaps that exist in research. What could be potential research outputs that we as Coordinate community can bring together and think through and write together and share. So very quickly, CoreNet is the COVID-19 research network. It's set up as an effort towards building a community of practice to foster both exchange and collaboration among research organizations who are all working on COVID-19 in India. There are two broad interests. One is to maximize the impact of all the research that's coming out presently, and secondly, to also improve the quality of the research by improving the standards of ethics and equity that are practiced. So that was what I just spoke about. A quick summary is that CoreNet at the moment has over 42 member organizations who are onboarded. They work across 23 geographies in the country. We have over 60 research projects that are submitted on the web platform. I'd encourage all of you to have a look. It's www.corenet.in. We're also actively pursuing for all of the community to engage with each other on Slack, where we already have over 140 members, so please join that. And along with that, we also have two working groups where two sets of researchers are working more deeply on inquiry around commonalities and producing shared outputs around both nutrition as well as the frontline worker space. And we do a series of public events and members-only events, one of whom is the Coordinate Coffee Hours. So welcome. And in case if you're not part of the community or you feel like you need to be onboarded, please reach out to us at hello@coordinate.in. Coffee hour sessions are again planned as informal conversational sort of hours where the community meets up to chat. So you're very welcome to also share with us ideas for future sessions, something that you would want to present, share with the community. We'd be more than happy to organize that for you. With that, I want to know whether Sonalde is online.
Shantanu and Neera.
Yeah, she just joined. Sonalde is here as well.
Great. Welcome.
Great.
Hi. So with us, we have Dr. Sonalde Desai, who is from NCAER and is going to share her thoughts with us. So over to you, Sonalde, without further ado.
So you're on mute, Sonalde.
Thank you very much, Rohan. First of all, let me acknowledge my co-authors and collaborators, Neera Deshmukh and Santanu Pramanik, as well as the whole team at NCER National Data Innovation Center. This was not a research that would have been possible without a team effort that started actually quite a long time before the COVID-19 struck. We began this work in early February, and the goal of the project at that point in time was really that we wanted to get better measurements of women's work. When we started, we had this idea that we thought that the measurement of women's work was not being adequately undertaken because of the way the questions about work were worded. And we wanted to have a better measurement. And can you move to the next slide, please? So what we decided to do was that we wanted to make sure that we ask questions in such a way that we would be able to measure women's work participation in a way that is much better done than in NSS, because the National Sample Survey tends to often ask question about, what is your primary status, what is your secondary status. And we had an idea that when women are being asked, or actually anybody is being asked what you are doing, you tend to sort of often respond to things which seem sort of very central to your life. So college student would say, oh, well, I'm a college student, okay? Or a housewife might say, I'm a housewife. But they would not necessarily tell you that, oh, but at the same time, I'm doing tutoring. I'm stitching clothes, I'm selling clothes, I'm making pickles and selling them, I'm working in my family farm. They might often respond to you what their central activity is. And perhaps we should word questions in such a way that is better able to capture this, their actual activity. And the second part of it was that we also thought that sometimes women's activities change month to month. And so we should collect the data in such a way that we are collecting data for the this transition in activities as well. So for example, when it is harvesting time, women may be more likely to participate in agricultural work, and they might take some time off when it is a festival season. So the idea was that we would do one face-to-face interview and then follow it up by monthly telephone interviews. And they were supposed to last for 12 months. So we began in February with a face-to-face interview. And then we started with the telephone interviews for people whose interviews were conducted in February. We started in March. People whose face-to-face interviews were conducted in March. We started telephone interviews in April and so on. And they were expected to last for 12 months. Just as COVID-related lockdown began, we discovered that, this was a time when our monthly phone interviews were meant to stop. And perhaps it would be a good idea to continue them so that we can capture the effect of the lockdown. So our respondents were very used to our phone interviews happening every month. And that allowed us to continue it and sort of capture the effect of lockdown. We were doing interviews with both men and women. So what I'm going to do right now is present the analysis of this data to show whether the impact of lockdown varies by gender. This data comes from the Delhi Metropolitan Area Study Employment Module, as I mentioned. In 2019, we started with face-to-face interviews and then followed up with monthly 5-minute calls in which we would ask them whether over the last month they had engaged in small business, salaried work, daily wage work, etc. Next slide, please. One advantage of this particular, and because this is a methodologically driven group, I want to spend just a couple of minutes telling you about our methodological results. Okay, and what we find is that there is a tremendous difference in the number of people who are seen as working, depending upon how you word the questions. When we asked the question about, what was the primary activity you did in the last 30 days, okay, about 26% of the women and 89% of men, ages 20 to 59 in our sample said that they were working. When we enumerate, did you work on family farm? Did you take care of livestock? Did you participate in a family business? Or did you engage in farm or non-farm work? The number of people who say that they participated in any kind of a work increases, mainly for women, and this increase is substantial. It goes from 28% or 26% of the women who say that they are employed under one definition to 32% under the second definition to about 38% when we capture even the animal work. We don't see the same change for men, and interestingly, actually there is a very mild decline for men, because a lot of times the work that is being done in the family gets attributed to the male head of the household. If the family owns the farm and it's mostly the woman of the household who is doing the work, even so, when the interviewer typically asks you, what are you doing mainly? It's likely that the male head of the household would say, I'm a farmer. But when it's asked in detail whether he actually did any work in these activities, we may discover that it's in fact his wife who is doing most of the work and he is actually doing something else. So what we find is that there is a substantial improvement in the number of women who say that they are employed compared to men. For men, the numbers remain more or less same. Next slide, please. After the initial face-to-face interview, we did telephone interviews which were less than 5 minutes, and where we asked whether women and men had participated in any of these 5 listed activities: farm work, animal work, or taking care of animals, wage work, or a small business over the preceding 30 days. And these interviews had continued through the lockdown, and they are even now continuing. Okay. We have had a fairly low attrition rate compared to the baseline. So in the baseline, compared to the baseline, about 93% of the sample took part in one or more telephone interviews. Although if we look at all 15 months of interview, we'll see some more of an attrition. But we have done a fairly detailed analysis of attrition, and we find that in spite of some of the attrition as the interviews have continued, people who are dropped don't come from any specific categories, such as more likely to be upper income or more likely to be educated. We seem to have a fairly good consistent sample over time with similar kind of characteristics. Next slide, please. Okay. So, coming to the question that you are really interested in, which is what happened during the lockdown. Okay. Did employment decline for either men or women, and whether this decline was greater for a specific group of individuals? Let me present some very simple descriptive data that I will present at a later point using more of a multivariate analysis. If on the left panel on your screen that you are seeing, we have men. On the right hand panel, we have women. At the top of the panel, you see results from interviews that took place before the lockdown. At the bottom of each panel, we see interviews that took place following the lockdown. And the sample sizes that are shown basically describe the number of interviews. Some of the individuals have been interviewed multiple times because we have multiple monthly interviews that took place. Some of the individuals might have contributed only one interview during the lockdown. The results basically show that for men, the proportion of men who did any work before the lockdown was 86%. It fell to 61% during the lockdown. For women, the decline went from 38% to 25%. Wage work suffered the most. So men who were doing any kind of salaried or waged work, rather than working in the household business or household farm, their employment fell from 50% to 34%. For women, the similar decline was from 14% to 8%. Self-employment decline was somewhat smaller in size. For men, it fell from 45% to 32%. And for women, it fell from 26% to 17%. Now, these are sort of very basic descriptive numbers. It would be hard to draw any conclusion out of that because we are mixing up urban and rural residents. We are mixing up educated and uneducated women and men. We are mixing up interviews that took place in January with interviews that took place in May. So in the subsequent analysis, what we do is we estimate a multivariate model. Next slide, please. Rohan, can you move forward? Yeah. What we estimated that next is a multivariate analysis in which we look at the monthly employment probability, controlling for the month of the interview, controlling for, next slide, please. Okay. Controlling for age, education, state of residence, because our survey sample comes from Haryana, Delhi, Rajasthan, and UP. Urban residents, religion, and caste. Next slide, Rohan. So these are sort of the results where we basically show the odds ratio of working during lockdown versus pre-lockdown, okay, for both men and women in different types of work, and by controlling for seasonality of work, individual specific random effects, age, education, religion, etc. And what the results basically show is that for men, the odds of being employed, okay, were only 0.06 during the lockdown compared to pre-lockdown once we have taken into account all these other factors. For women, they are 0.18. Wage employment declined. So what the first thing I want to point out is that the decline for women is smaller than the decline for men. Our prior was, then our prior is based on some of the other studies by some of the other researchers, that women's employment will be much more affected than men's employment. And what we actually find is that men's employment is far more affected in terms of negativity associated with lockdown than women. And this is something confusing, okay? We don't really expect it. We expect women to be more affected. After all, literature tells us that, men are often in jobs where they can work from home. They are often in more technologically driven jobs. They can work from home, so they should be less affected. Men would be more likely to take the risk of some of the virus-related health risks and continue to work, so they should be less affected. Why should it be women who are less affected? And I think that the results sort of become clearer once we look at it in a more nuanced way, where we differentiate between wage employment and self-employment. When we look at wage employment, still stay on the previous slide, please. When we look at wage employment, we find that odds ratio for women is much lower than odds ratio for men. Women are far less likely to be employed than men when we look only at people who are working for wages. And again, please let me remind you that we are only comparing here the changes between the two time period. Everything else, person-specific effect, age, education, everything else is controlled. And we are comparing the same individuals here. What we find that when we look at wage work, women are far more negatively affected than men. But when it comes to self-employment, okay, women are much more protected and men are more negatively impacted. Both of these have to do with the type of occupations and activities that men and women engage in. Men are protected in wage employment because many of the men in Delhi metropolitan area are working for the government, and they were not really laid off. They continue to be paid. They could have worked from home. Whereas women are more likely to be sort of in more kind of a casual wage work, which they were unable to carry on with. But when it comes to self-employment, many men were involved in owning small business, vegetable vending, and various other activities, which were far more vulnerable to lockdown. Whereas women were far more likely to be working at home or on family farms, which they could continue to do even during the lockdown. So what's happening is, interestingly, that when it comes to wage work, women are far more negatively affected. When it comes to self-employment, women are somewhat protected. And overall, because women are far more likely to be employed in self-employment rather than wage employment, the combined effect is such that the impact of lockdown was higher for men than for women. Now, could you move to the next slide, please? We also looked at the impact of, interacted the impact of lockdown with gender by different religious groups and by urban and rural areas. While I want to present the religious results, I also want you to caution you that our sample size is very small. We only have about 120 Muslim men, 120 or 110 Muslim women in our sample. And many of the lockdown interviews occurred during the months of Ramzan. And so there is some possibility that our effects, the results that I present, are biased by both small sample size and effect of Ramzan. But I do want to present to you that overall the lockdown related decline was much greater for Muslims than for Hindu. Now, what I'm doing here is, unlike the odds ratios that I presented earlier, I'm presenting here the predicted probability of employment, holding all other variables at their mean value. So basically, the way to read this would be that the Hindu men were about 0.88, predicted probability of pre-lockdown employment for Hindu men was 0.88, which fell to 0.61 during the lockdown period. Okay. For Muslim men, the employment probability was 0.80, which fell to 0.37 during the lockdown period. Okay. For Hindu women, the employment probability in the pre-lockdown period was 0.36, which fell to 0.23 during the lockdown period. For Muslim women, it was lower to begin with. Only 23% of Muslim women were employed, 0.23 predicted probability, and it fell to 0.09. So what happened was that there was a greater decline for both Muslim men and women. It's not that women suffered more or men suffered more, both had sort of similar magnitude of decline. We also find that overall the impact was much greater in urban areas than rural areas. And this you will not be surprised hearing, because if you remember, there was a much greater employment decline associated with lockdown for people who were in wage work as opposed to people who were in self-employment. and self-employment contains a large number of family farmers. Again, we see that employment probability was pretty high in a pre-lockdown period for both men and women, 0.91 and 0.81, which fell in rural areas only somewhat. It went down from 0.91 to 0.75 for men, and it went down from 0.44 to 0.31 for women. In rural areas, urban decline was sharp and very substantial. For urban areas, men's employment probably fell to almost half, and women's fell even more than half. So for women, the employment probability was 0.26 in urban areas, which fell to 0.11. Okay. So if I were to sum up here, okay, I would say that we have what we are seeing is, first, that men's and women's employment is affected through the kind of occupations and industries that they are working in. Overall, farmers were much less affected than wage workers, and consequently, there is some protection to women because they are located largely in farming and self-employment. But at the same time, when women were employed for wages, they were far more affected than men. So in some sense, women's vulnerability continues. Their vulnerability is pretty high when they are working for wages. It's not nearly as high when they are self-employed. And that sort of, from public policy perspective, it sort of makes us wonder about a number of questions. The first question that we wonder about is whether, this reduction in wage work, to what extent it has a long-term impact in in terms of the domestic power negotiations within the household, because self-employment does not bring the same kind of access to money and intra-household bargaining power as working for wages does. And a decline in wage employment, does it really lead to subsequent decline in household power and bargaining at the same time when all the domestic responsibilities for women are increasing? And second, whether self-employment, which are there specific types of self-employment which may be more affected and hence might have left women more vulnerable? I'm hoping that colleagues from SEWA and ISST would have more to add to this. Thank you. Let me end here.
Great. Thank you so very much, Sonalde. This was extremely interesting. I look at the clock right now and it's about 4:33. So maybe in the interest of time, I'm now going to invite Dr. Priya Nanda from the Gates Foundation and the Secretariat to maybe moderate the next three reflections. So Priya, if I can have you over and maybe walk us through the next three, and then we open it up to the larger group.
Okay. So we were being very ambitious when we thought we could carry a whole conversation on gender in 50 minutes. But let's just say this is an appetizer. Sonalde's presentation is really thought-provoking, and it juxtapositions very well with some of the other colleagues who are going to talk, because they are actually organizations that have either worked on or done research much more on women's informal work, and really trying to understand how dispensable or non-dispensable it has been during COVID. Sonalde's presentation has provoked us to think our assumptions about women's work and self-employment may be actually challenged, because it was much more protected during COVID because of the location of work. But of course, we know women's informal work has homes, but it also has streets and markets. So I'm keen to find out what our other colleagues have to say. So I'm going to start with Sabha, who's from SEWA. Sorry, we are only giving you 5 minutes each. Think about reacting to what Sonalde has said, as well as really putting the points that are coming across from the work you're doing. So 5 minutes, Sabha. We'll have more time in future conversations. Over to you.
Hello everyone, my name is Saba. I work with the Self-Employed Women's Association, SEWA Bharat. In response to what Sonalde was talking about self-employment and its impact on women, I'd just like to quote two small examples. Predominantly, my work is with social enterprises that are owned and collectively run by women. We also work on livelihoods because we are a trade union. For one of our farmer producer companies in Bihar, while the women themselves recognize themselves as farmers and are champions of the cause for organic agriculture and sustainable practices, it was during the time of COVID lockdown that they had struggles telling the officials that they needed passes to travel to sell their produce in the market, and the officials did not recognize them as farmers. They would ask for their husbands' documents or for their husbands to go and make the sales in their name. Um, while they had recognition for themselves as farmers, the state did not. Similarly, in Gujarat, we have a health-based cooperative where our health workers are also they deliver medicines door to door, but they're also frontline health workers themselves, and they take up the cause of awareness for and preventable measures. They were not allowed to travel by themselves. An auto was arranged for them so that a man could ferry them around, and the requirement was that they own vehicles that so that passes could be issued to them. So I mean, that being said, while we have a lot of positive hope, and there is scope for women run enterprises and social enterprises, there is a gendered response of the state that must be taken into account, and how there must be more advocacy so that women are recognized as entrepreneurs. Um, while we were carrying out our study at during the lockdown, we were generally looking at what the effects of the lockdown were on the way women were accessing essential services, healthcare, government-sponsored relief schemes, entitlements under the Jan Dhan scheme or old age pensions. What were the added vulnerabilities of these informal workers during the and after the COVID lockdown? So we also try to estimate a long-term impact. When we asked women what were they how were they managing their expenses, how were they making ends meet, 78% of our respondents said that they had run out of savings, which in turn led to a finding that 71% of our respondents had taken loans from within the family or the community to manage household expenses, because they were scared of going to the money lenders as they were charging a more than higher interest rate. Those 7% women told us that because of the lack of options, they ended up taking loans from the Mahajan or the Sahukar. But this was something that they had to do as there was no other means of income or saving. Only 5% of our respondents were able to earn some sort of livelihood or make some income through alternative means. And that was a problem, because nobody had, while there was a culture of saving and 17% of our respondents were able to manage from their savings, but majority were not able to. When we asked them what were they spending their money on, they said that most of them needed it for agricultural inputs. The Kharif season had started. They had to sell off their Rabi crop. The fodder was a problem for the cattle that the animal husbandry required them to keep into account. While they had got ration or in the form of wheat or rice from the state, but they also needed other cooking essentials to make food, and that was something they had to allot a specific amount of money for. Mobile recharges was something that worried them, because the women had school going children. Most of the women had school going children, and with the digitization of school education, mobile recharges were something that they could not compromise on. This was another problem, because some of the women told us that their mobile phones were the ones being sold, because they were the additional in the household. The man's mobile phone was not, to get some sort of liquid cash in hand. Rent was a concern for a lot of respondents. They were paranoid about how, even though the landlords had told them that they could avoid paying the rent for the duration of the lockdown, but they told us that the burden of paying a collective 2 or 3 month lump sum rent to the landlord is something that worries them. So they were very concerned about the kind of how they would meet their expenses. But while we were looking at how they were spending their money, we also decided to probe into how they were spending their time. And when we asked the women what they were spending their time on, they told us that the household chores and the in general work that they do in and around the house has increased. Men, even if unemployed, were not helping women around the house. This was something that came across when we spoke to our respondents. Um, Arranging and managing food supplies, worrying about budgeting. There was also a lot of stress about social distancing and isolation, and also fear of contracting the disease that took up a lot of their mental space. A lot of women spoke to us about Mansik Tanav. Mansik Tanav only because of social distancing, the isolation, the fact that they could not have a support system to reach out to people. Um, Economic impact of the pandemic has always, I mean, economic impact has always been more on women than on men because they're out of work for longer durations. They are also scared that when they go back to work again, they might be paid lower than before. Men can return to work immediately after crisis, but women cannot. I mean, there are a lot of factors. Schools have not opened. Where do they leave their children? Anganwadis have not opened. Where do they leave their children who are young and cannot manage by themselves? These things are not really given enough space in policy making or decision making forums.
Sabha?
Yes.
Sorry, one more minute. Yeah, if you can wind up.
Yeah, I'll just wind up. Through our study, we also realized that the kind of work that we do with our community leaders, who are called Agewans in SEWA terminology, the kind of work that they have done has really shown uh, through the through the pandemic and the lockdown and after. We can say that they have led the work that SEWA does. Community-based social protection is an idea that should be explored. People should be empowered locally. Our Agevan Bens have helped with alternate means of livelihood. They have helped people make masks. They have helped set up community kitchens. They have helped identify vulnerable households and help them get food supplies, ration kits. So the crux of our work is based on the strength of these local leaders, and we really support the cause of community-based social protection through our work. So I think I'll wrap up because I'm out of time. So
No,
thank
it
you.
was such a great summary in such a short time. Very, very important stuff, which I'll summarize later if there's time, Sabha. I'm now going to do the same rapid fire, moving to Shiny from ISST that's done a small qualitative study. So over to you, Shiny, Chakravarti from ISST, just roll into your analysis. Thanks.
Good evening, everyone, and thanks, Sonalde, for such an insightful presentation. Before moving into our own ISST's work, I would love to hear from Sonalde. Like, have you found any kind of increase in unpaid domestic chores among women that in your survey? And if so, like, have you observed any kind of increase in unpaid chores by men also? Like, even the recent CMI survey that have highlighted, like men are also involved into the unpaid domestic chores. The other point I would love to hear, according to the recent ILO classification in terms of sectoral impact, in terms of impact of the COVID-19 across different sectors, we found that there are few sectors like manufacturing and even in services like personal services industry and particularly for the ASHA and Anganwadi, like the frontline health workers. In particular, these industries, the impact of the COVID-19 in terms of job loss is much more. So have you found any kind of that sector-specific impact? Now,
Shiny, go into your study, and for Sonalde, put the questions in chat, please.
Yeah.
So how did you go into your study? And then we'll let you put the questions for Sonalde on the chat. Thank you, Shiny.
Okay. So in terms of our own ISST survey, we did a small sample survey during the month of April and May, during the second week of April and May, to see the impact of the COVID-19 pandemic lockdown on women informal workers in 5 different sectors in Delhi. That is the domestic work, street vendors, waste workers, sex workers, and domestic workers, construction laborers, home-based workers, waste workers, and the street vendors. So we found that our result pointed to the major impact of the lockdown on the earnings of these workers, particularly for the construction workers and the street vendors. Near about all the construction workers, they have reported that they have suffered a kind of loss of paid work, and similarly, 97% of the street vendors, they said like they had no source of income during the lockdown. Now, in terms of if we see the situation of the women, we found that basically there is no special benefits have been announced by the Delhi Welfare Board, particularly for the women construction workers. In terms of home-based workers, they have reported that owing to the closure of factories and supply chain disruptions, restriction of transports also carrying raw materials and payments withheld by the subcontracts, they are facing a huge kind of shortage in terms of their income. And in terms of waste picker, in spite of the occupational segregation, like within the waste for the waste pickers also, there is a division of work. Like women they are mostly segregating the waste inside the house, where men are involved more into collecting the same. So we found that they face difficulties not only in collecting waste owing to the restrictions on movement, but also while segregating and selling the same, they face difficulties because all shops were closed and they were forced to sell the waste at a significantly reduced prices. Now, for the domestic workers, because our survey, we did this during the month of April, during the second week of April. So we found that time that the impact was the impact of the pandemic on the, particularly for the domestic workers was less, because they anticipated a cut in their income during the month of May, June, whereas most of them, they have reported, yes, we have received the salary for the month of March. And so but the informal relationship into their employment, that was really highlighted by, because one of our respondents, she mentioned that she has been working in a house for the last 12 to 15 years, but since the lockdown, not a single employer has called her to ask about her well-being. Like she highlighted about the informal relationship between the employer and the employee. Now, in our survey, we found that 68% of the respondents, they stated their inability to go out due to lockdown and police patrolling, and and about 55% reported like their fear, they fear of contracting the disease as the main reason for their inability to go out to work, and as the reason for their drop in income. When these women informal workers were already struggling in their day-to-day life, they are actually more concerned about the continued loss of paid work. And house rent was another important factor which they really mentioned. Apart from emotional and mental distress also they have mentioned. But the point is that still they don't want to go back to their place of origin, because what they mentioned, because in their place of origin there is really a lack of adequate livelihood opportunities, and their landlessness in their village is another reason. That's why they don't want to go back to their village. In terms of the most of the women workers, they indicated the unequal division of domestic responsibility and stated that no one helped them with the household chores. So this is the kind of our short findings from our study that we did during the month of April, and we are now again planning to do a kind of, since the survey we did is almost 5 months have been happened, we did this, and we are expecting to do a similar kind of survey to see what happened during the unlock period, because the unlock period has also started and it has crossed 3 months. So it appears really important to revisit the same respondents of the previous study to understand and assess the situation during the post-lockdown period. This is a kind of, we are expecting this is a kind of study that will be able to come out at the end of this year to highlight the coping mechanisms that they may have adopted and the significant changes that may have occurred in their immediate social and economic situation. My colleague Monica is also here. So Monica, if you want to add anything else, please go ahead.
No, it's fine, Shiny. I think you have very nicely summarized.
Great. Well, thanks, Shiny. Given that we have so little time, I'm going to ask Kanika, if you could just build on, I know because IWWAGE is doing a lot of work, so if you can just build on and reflect on what you've heard for about 5 minutes. I'm sorry the time is short. We will have a sequel discussion on this topic again. Over to Kanika.
Thanks, Priya and Rohan, and thank you again, Sonalde, for a great presentation. just picking up from what Shiny and what Sabha shared. In fact, we undertook not a COVID-specific study, but we were actually evaluating one of SEWA programs in Jharkhand, West Bengal, and we saw similar trends in terms of the impact. So we did have a module in the questionnaire where we did ask about COVID-related impacts and the impact of the lockdown, where we did see the impact on informal workers, particularly the impact that the lockdown had on agricultural workers. A lot of them reported that their access to local markets as well as agricultural inputs was affected. When we look at wage losses, almost half of our sample reported that they faced wage losses. Almost close to less than half of the wages were cut during the period of the lockdown. And so, similarly, we also tried to ask about access to PDS and ration shops, where a small proportion of the sample also, indicated that their ability to access, both these sort of relief measures was affected during the lockdown period. But apart from this particular study, we've of course done other pieces of work that sort of are across different parts of our IWWAGE thematic areas. One interesting study that's still ongoing is being led by the Economic Research Foundation by Deepa Sinha and Jyoti Ghosh. And they're largely looking at public employment opportunities for women. And as part of their study, they did end up looking at the COVID-19 impact on frontline workers in Bihar and Telangana. So I'm just going to very briefly share some key insights from their qualitative work. In the last between May and June, they undertook 22 interviews with frontline workers. These are both ASHAs and ANMs. And as most studies and other reports have been showing, there have been sort of issues around remuneration and incentives being delayed for these workers. In Telangana, almost 10% pay cuts for Anganwadi workers, while in Bihar, almost only 600 rupees was received by ASHA workers who are working on COVID-related surveys, but they do not receive their regular honorariums. Again, there were issues around inability to access masks and PPE and other sort of protective gear for these frontline workers. Of course, issues around stigma, and local violence was reported against these workers. Another important piece of research that Madhulya, who's also I believe on this call and also shared it on the Slack network, has undertaken on women-led enterprises and the impact COVID-19 and the lockdown has had on their lives and their enterprises. So, in fact, I think Madhulya shared the findings from this study on the Slack network, where a very sort of key finding that emerged was that 1 in 3 women-led enterprises were either temporarily or permanently closed. In terms of the impact on businesses, the risk appetite and the business outlook of these women-led enterprises has also shifted and gone down, which again are sort of very worrying trends that we've observed as part of the survey that they undertook. But of course, there are other streams of work ongoing at IWWAGE. Happy to share them over the Slack network, but I'll pause here. Thank you.
Thanks, Kanika. I apologize that there isn't enough time. I'm going to actually let people ask questions which are clarifying to Sonalde, because she really presented a lot of really unique data. So if anybody is there, I haven't seen many questions in chat, but if anybody wants to speak up and ask any questions, or if you have any overarching comments, please go ahead.
Yeah. Can I ask a question to Sonalde Desai? Thanks a lot for your presentation, Sonalde. So the real work for women, finding that was very interesting. One thing I was wondering is that by any chance, I mean, it's kind of comment/question. Would that be tied to the financial aspect? So basically, if you think of housewives, it's a very old issue. All the services produced by housewives within household don't get accounted in the GDP precisely because it doesn't have market value. Similarly, the activities that you mentioned in your presentation, those activities also maybe they are seeing that as part of their household chore and not really as work. So it could be tied to the financial aspect. There is no monetary value attached to it for them, and that's why they don't see it as work for themselves.
I totally agree. I think that there are certain types of activities, especially self-employment, where they don't get the income. Even though farming brings in income to the family, it is not individually always given to the individual women. They tend to see it as sort of extension of their own work, and hence they don't report it. And this is one of the things that our project began with, the idea of getting better reporting. And this was definitely one of the primary motivations. So you're absolutely right. Okay? That what you report as work, sort of when you are working for wages, you will report it as work and there'll be no question. When you are working for things where you don't get necessarily direct payment, the family gets the income, you don't see it as a work.
So, Lakshmi, did you want to talk about the framework? You just put out a chat message.
Hi, no, I mean, I'll just leave it to others in case there are questions. I can definitely participate in a later session. I have nothing specific to add. Thank you.
Any other questions for Sonalde or for anybody else, any of the colleagues? Yeah.
Hi, Sonalde. This is Sapna from IFMR. I just had one question, whether you looked into migration status. I'm sure that might be a smaller sample within your sample size. And also another thing is whether any of them were working online, saleswomen, online saleswomen, or these kind of jobs that, are particularly looking out for women, to employ women. So was there a category that you looked at?
I think both are phenomenal questions, and unfortunately my answer is no, because we are dealing with a relatively small sample in which number of people who are in both we did not have very many migrants in our sample. We actually looked for it at some point in time, but we realized that with a sample of about nearly 1,000 men and 1,000 women, there weren't very many migrants, nor did we fully collect data on online work, because that was not how the study had been designed. But this would be something that would be really worth having.
Sonalde, there was a comment that Sabha made which was very intriguing to me, which she said that men can easily return to work, but women cannot. I wondered if you have a response to that, both from your study but a broader perspective on women's work.
No, I think Sabha is absolutely correct. I think that there are a number of issues involved in it, where in terms of return to work for men versus women. One of the things, of course, is also the whole issue of fear of the disease. And a lot of families have sort of designated one person to be the person who does the shopping, who does the other activities. And often men tend to be the ones who sort of return to traveling outside the area for work and so on. I think one issue we haven't raised here is the childcare issue, that a lot of children, obviously kids are at home, they're having to study from home, and that sort of increases the work burden on women, even professional women. Even our colleagues are all sort of finding this a difficult challenge to be dealing with. And among upper middle classes, it's online education. Among the poor, it is just simply pure childcare related issues, which would make it difficult for women to return to work.
Any other questions from the floor or to anybody? Otherwise, I wanted to ask one more question, but I invite you all to please actively put it on chat, or also just simply ask here. Okay. We really wanted to also have this discussion to start thinking as a community, what are some of the next generation questions coming around women's work. So even the people who've talked today, it would be really nice to have an offline conversation amongst those who want to join that discussion, just to think about how we might frame the next set of questions. It doesn't matter who's doing the study. So if you are interested in kind of talking about gender and work, we'll set up the Slack channel, join it, and let's discuss what is it that we can be thinking about for the next set of studies. I think we'll need a part two. We haven't done justice to anybody today to kind of go into depth, but I think the issues kind of reinforce and layer each other. One thing that I was struck with Sonalde's presentation was the fact that if women in self-employment are really cushioning the effect of income loss to the entire household, and they taking Saba's point, they're already taking care of all of the burdens and domestic chores, then actually the burden on women is much more intense. Saba also talked about the Mansik Tanav. So I think that really we always talk about double and triple burden, but I think we need to kind of deconstruct and unpack that and repackage that, because it becomes so easy to say triple burden. But what does this really mean in terms of how women multitask and manage, and their mental health issues, I think came up very strongly for me in this conversation. Apologize, we are at time. Over back to Rohan to end, and we will have a second conversation on this topic. Back to Rohan.
Great. Thanks so much for this, Priya. Yes, we are apologetic that we were really ambitious in plotting this session, but thank you for your time. Again, I would encourage all of you to please join the Slack workspace. We are really keen to have these conversations, not only in this like time that we spend together, but also asynchronously over Slack. So it will be great if you could all join that and we can take that forward. Again, thanks very much to Dr. Desai and everybody who's been able to join us from SEWA Bharat, from IWWAGE, and from ISST. Thank you to all of you. This is the largest turnout that we've seen on a coffee hour so far. So this is extremely encouraging to us. This gives us the feeling that we're making relevant content. So thank you.